Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing claudication. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started, guys. So what is claudication? So it happens when we get pain, and for example, most of the time it's in our legs, okay, when not enough blood is getting to our muscles during exercise. So when we're walking at, say, a certain pace for a certain duration of time, we can start getting this aching pain, and it normally stops with rest, okay? Now, over time, and as the condition worsens, it can also start happening at rest also. So it is normally a symptom of disease. So normally it's arterial or peripheral arterial disease, okay? So arterial means your blood is going, so your arteries going to your limbs. So this is what brings your blood to your limbs to oxygenate them, bring in oxygen, okay? And if our muscles are not getting enough blood, enough oxygen, they will start aching, okay? So this is normally a good indication of narrowing of the arteries in the limb or restricted blood flow. Now, treatment normally focuses on reducing pain, increasing mobility, preventing damage to the tissue, and sometimes they will do vascular surgery to open up so the arteries aren't so narrow. So symptoms. So claudication refers to muscle pain due to lack of oxygen and nutrients to the muscles, okay? So you're using more than it's getting. So the blood is not getting to those muscles quick enough. And when you're using your muscles, it needs more oxygen, needs more nutrients. Okay, so we start with the symptoms. So pain, ache, discomfort, fatigued muscles, pain in the calves, thighs, buttocks, hips, or feet. Sometimes, this is less often, pain in the shoulders, biceps, forearms. And then the pain normally gets better when you rest, okay? Now, as symptoms get worse and we become in a more advanced stage, this will start happening at rest also, okay? And we can also experience in more advanced stages cool skin, severe constant pain that does progress to a numbness, skin discoloration, and wounds that will not heal. So when we have a lack of blood flow to our lower limbs, this is arterial disease, and it can cause arterial ulcers. Okay, so when we're not getting that blood flow, it can cause ulcers, and they're very painful, okay? So when do we see our doctor? So if you're experiencing pain in your arms or your legs during exercise, and you have rest and it subsides, you should get a hold of your doctor, because it can worsen and it definitely affects the cardiovascular health. Okay, so it affects your heart, and it can also lead to increased risk of heart attacks and strokes. Okay. With that said, there are other conditions involving the blood, nerves, and bones that can contribute to leg pain, okay, during exercise. So we would want to rule out if it's claudication or other conditions. So you always want to see your doctor if you are having these signs and symptoms. So what is the cause of claudication? So like I said, peripheral arterial disease. So this is when our arteries, they have restricted blood flow. So this is either caused by a buildup of fats, cholesterol, other substances on the artery walls. It's called plaque. Okay, so when we have that narrowing of the walls, okay, so we have an artery and all of a sudden it starts narrowing, not as much fluid is going to be able to get through there. Okay, so that's okay during rest. That's why it doesn't hurt at rest, because normally our muscles are getting enough oxygen and nutrients that it needs during rest, so it doesn't hurt. But when we start walking and using more oxygen nutrients, it's going to start hurting, because now this isn't enough. Okay, when it's clogged in there and it's getting tight for the blood to flow through, it's not enough blood for our muscle needs. Okay. So risk factors. So potential risk factors for peripheral arterial disease and claudication. So they include having a family history of peripheral arterial disease or claudication. So if they have like fat buildup in their arteries, if you're older than 50 and you have smoked or have diabetes, if you are older than 70 years of age, chronic kidney disease, diabetes, high blood pressure, high cholesterol, obesity, and smoking. They are all risk factors for peripheral arterial disease, okay? So narrowing of the arteries. So what are some of the complications? So claudication is generally a warning sign, okay? It's a warning sign that your blood flow is not flowing properly. Now, this puts you at an increased risk of heart attack and stroke. And it also puts you at risk for skin lesions that don't heal. Like I just said, arterial ulcers, super, super hard to heal, because we cannot heal wounds that are caused by not enough blood flow. How do we fix any kind of wound? We have to fix like what is causing it. We have to fix that. We can't fix this unless they have surgery to open up those arteries. We can also have death of muscle or skin tissue, so gangrene. They can lose limbs because of this, okay? So this is generally a warning sign. That's why you always want to see your doctor if you have signs and symptoms of this. So prevention. So really, it's just living a healthy lifestyle, okay? You got to live a healthy lifestyle, eat healthy, well-balanced diet, exercise regularly. If you have diabetes, keep your blood sugar in control. This prevents a lot of complications. Manage a healthy weight, manage cholesterol and blood pressure. And if you are a smoker, you should stop smoking, okay? Or reduce the amount that you are smoking. So how is this diagnosed? So honestly, a lot of times it goes undiagnosed, because although the pain is unwelcomed, a lot of people see this as a sign of aging, okay? So they reduce their level of activity to avoid the pain, okay? So diagnosing this is really based on a review of symptoms, physical exam, evaluating the skin of the limb, and tests to check the blood flow. So the tests that we may possibly do. Pulse measurements in your palms and feet. This assesses the blood flow throughout the entire limb. An ankle brachial index. So this is comparing blood pressure in the ankles to the blood pressure in the arms. Now, I do have a video I will link here about ankle brachial pulse index. I have the video. I might as well stick it there. Segmental blood pressure measurements. So this is a series of blood pressure measurements at different areas of the arms or the legs to help determine the amount and location of damage to the arteries. Exercise testing. So they'll see the maximum amount of distance you can walk without pain. They can do a Doppler ultrasound to see the blood flow, MRI or CT angiography to check for narrowed blood vessels. So those are the different tests that they can choose to run, okay? So treatment. So reducing pain and managing the risk factors that contribute to heart and blood vessel disease. we want to control this. Okay, so exercise is going to be a very important part of treating claudication. So it reduces pain, increases exercise duration, improves vascular health. So we want our vascular system to improve, especially in the affected limb. And it also contributes to weight management and overall improved quality of life. So recommended walking programs, they tell you to walk as far as you can until you feel moderate pain, and then you're going to rest. Okay, and then you're going to walk again. So you're going to repeat the walk, rest, walk cycle for 30 to 45 minutes. Okay, you're going to do this 3 or more times per week. And when you start this, it is recommended that you do have supervised exercising at the beginning. Okay, but long-term at-home exercise is definitely very important to manage claudication. And then they also do have ways of opening up the arteries for treatment. So there is surgical methods also. So medication. So a lot of times they will put you on medication to prevent further complications, right? So pain. So they can give you pain medication to help increase blood flow to the area while you're walking. If you have high cholesterol, they'll give you a statin. High blood pressure. Like these are all things that we need medication for, and to be able to control to prevent further complications and worsening of the disease. Okay. And then they may also give you antiplatelet drugs. So even like aspirin or Plavix to prevent blood clots from forming, because as our arteries narrow, sometimes we can have blood clots form because our blood is getting stuck along the way, and it creates these blood clots, creating even more narrowing. So we want to prevent all of this. So these are the medications to prevent that from happening. So surgery. So like I had mentioned earlier, there are ways to have surgery to increase the blood flow. Okay, so an angioplasty, this is where they widen the artery. So they put in a narrow tube and then they inflate a balloon, and they may leave a stent in there to keep the artery open. Okay, so this makes it wider again. Then there is vascular surgery. So this is where they take a blood vessel from another part of the body, a healthy part of the body, and put it to the area that is causing claudication. This allows blood flow to flow around the blocked or narrow artery. Okay, so those are 2 surgical options. So lifestyle and home remedies. So we always have to talk to our doctor about this, but there are things that we can do at home, like quitting smoking, exercising, eating a healthy diet, and foot care. Okay, looking at the feet to assess and make sure that we're getting prompt treatment for any complications. But these are all things that can definitely help with peripheral arterial disease. Also, when we have arterial disease, the toenails tend to get really thick. So that's why foot care is so important in those cases. But that is all I have for this video. I hope it did give you a better understanding of claudication. But that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now.